Hello guys, and welcome back to another video. And so today I just want to mention first that my mom and I are out on vacation in Wisconsin, and we just came here because you'll be able to see in a couple of seconds later, but the air is very clean and very nice, which is very important for the patient's health. And my mom also likes to fish, so we just came out here to enjoy it a little bit. And today I'll be talking about the extractor juice, so be prepared. But first, before we head in, I just want to show you guys the scenery. So how was the scenery? It's very beautiful, isn't it? Well, I think so too. But to get to the actual nick and knacks of this video, to start off, when a patient usually gets a cancer diagnosis, the first things that they change about their lifestyle is usually their diets. And one of the most well-known diet that breast cancer patients, or just cancer patients in general, use are the green and carrot juices. And the green juices are very important for the breast cancer patients and any cancer patients in general, because these greens usually contain about like vitamins, minerals, and these phytochemicals, and the cancer patients have to intake about 10 times more of these certain things than an average person would. And plus, they also have to look out for lipids, carbohydrates, and proteins from animals, which makes them take in a lot more of this. And so an easier way to absorb the needed amount is by making the green juice and intaking it. And then the carrot juice, for instance, they contain a beta-carotene. And in our bodies, these beta-carotenes change into vitamin A, which is very helpful in bone strengthening, which is very useful, especially if the breast cancer patient has been going through chemotherapy. And these beta-carotenes can also remove bad substances within our body as an antioxidant. And these green juice in particular, is the majority is based off of kale, and then you can add in other greens depending on what you want. However, because it is largely made from kale, it tastes very strongly at first, as in a not very good taste. So if it's hard for you at first, you can take about 1/8 of an apple or something like sweet fruit and mix it in to make it a little bit more bearable. And regarding on how much and how many times a day you should take this green and carrot juice, my mom usually takes about 2 of these mason jars for each carrot and green juice, and she takes it before she eats, or like right before she goes to sleep, when she's feeling more hungry, so that the absorption of the goods in the green and carrot juice can be absorbed more better than it would be compared to when she's full. So in around 500 to 600 milliliters are taken every single day, as one of these is about 250 to 300 milliliters. So now let's get started on the actual process of making the green and carrot juice. So in regards to washing the greens and the carrots, you first have to put it in the water for about a couple of minutes, and then you have to take it out and wash it in running water. So for instance, you gotta be wary of the back sides and like the ends for dirt and bugs, because you usually have to use organic vegetables, because organic's better for the breast cancer patients. So you wash, and then And then after you have gone through and washed all of these, you have to again put it back in the water, but then mix it with alcohol. So in my instance, I use vodka, and we use this alcohol to sanitize the vegetables so that they're more clean for the patients to use. So then after putting it in the vodka for about 10 minutes again, we then go through the same process of washing it and with the running water, and then we put it in a basket for it to dry. And then we move on to the actual extraction part of the juices. So after you have washed the greens and the carrots, then you have to make sure of a few things before you actually start grinding. For the green leaves, you have to make sure that, like for the kale, you have to throw out the ones with yellow leaves because that means it's not good. And you also have to make sure to throw away some of the ones with the ends that are all like messed up. For instance, let's find one. Like this one, where it's kind of like torn and like kind of mushy at the end. Yeah, you gotta throw away these ones as well. And then the rest, you have to make sure that, like, unlike for like this one, you have to make sure that the moisture gets all out before you actually put it in the grinder. And then for the carrots, for the big ones like these, you have to make sure to get rid of like these ends, because who would want to eat them, you know? And then for the more thin ones, you got to make sure to get rid of like the top, like the tips of the carrots, because these are also very dirty. So I will show you. And then for these big carrots, you would have to cut it in half for the hamburger way, and then you gotta cut it in half the long way, and then another time. And then for the small ones, you can only just cut it in half like the short way once, and then you'd be pretty much all set to go. So you guys can like put like the really thin ones already in, but then for like these thick ones, just make sure to cut it very thin so that it will easily be able to grind. So then next, I will then move on into the actual grinding part of the juice extractor. So before I actually get into the actual grinding part of the whole green juice, carrot juice, I would like to mention that I'm not trying to promote this specific brand, but this brand just worked really well for my mom and myself, so that is why we brought it along. And also I'd like to mention again that the reason why we use a juice extractor instead of a mixer is because the extractor actually like extracts the good substances from the greens or the carrots, while a mixer only cuts it up. And also, you have to repeat this whole grinding it in, and then taking it out and putting it in again about 3 times for the actual good substances to come out for the patients to drink. So now we will actually start. So that is how you put in the juices, and then it will come out in like this sort of crumb sort of manner. So then you will take the crumbs and then put it back in, and then it will come out. I have now finished the first round of the green juice, and now as you can see, these crumbs will be going back and forth 2 more times. But for this one, I'll be putting it in to preserve it. And I want to tell you guys to do this quickly as possible because the exposure to the air, as I mentioned before, is very important in this whole process. So now I will do this video 4 more until I finish the second and third time. So now that we have the first patch of the green juice done, we now have to move on to the second time. So first you will take this one here and then replace, and then you got to keep your left hand clean, because when you do this you will have to make sure you protect it from going into the juice and then put it into this hole. So as you can see, even the second batch, there are still crumbs coming out and the stuff. So you will be able to repeat this 1 more time with the ones that come out here after I finish this round. So see me at the next one. Okay, so then after I have finished the second and third, so now I am gonna just turn it off. And again, since this is time sensitive, we gotta go quickly. And then mix it up with the first batch. And again, you gotta put it into these little mason jars, but I will just go give it to my mom quickly. So I have just gave it to my mom, so now I'm just gonna move it quickly to the mason jars. And we're first gonna match it up to this line, and then if there's a little bit extra, we'll fill it up to the tippy top. And also I would like to just say that you can also drink the bubbles. The bubbles are actually good for you as well. So then after washing this, we will now move on to the carrot juice. And again, cleaning before making the carrot juice is very important. Now for the carrot juice, I will do this first one, then come back for the second round, and then I'll come back after I finished everything. So again, I will do it with the carrot. And then I will come back after. As I mentioned before, I will come back when I am doing the second round of this. And so I'm done with the first round of the carrots. So again, since they are time sensitive, I will be able to quickly move these. And in the second round for the carrots, they will turn a shade darker. So you will have to look for those ones because that's the one that's important. So now I will start the second round. And for the second one, you can also grab and put it in with your hands as long as they are clean enough. So let's begin. Yeah, as you can see, the drink is getting a little bit darker. Now I will see you after I am done with the third round of this batch. So now I have just finished the third round of the carrot juice. And so the procedure after this is pretty much the exact same as I did for the green juice. So after taking this, I will pour it into the first batch. But as you can see, the third batch's completed carrot juice is a lot more dark than the first one. And here's like the comparison. So I will just pour it in. And then after I will allocate it to each mason jar, and I also will give some to my mother. So now I will allocate these into the mason jars. And then as you can see, again, it's up to that bottom line. And then I will allocate it into each of these jars. And then again, for the preservation method, we put it in the refrigerator, and then the 3-day rules. If it is refrigerated for longer than 3 days, you can just throw it out because you have to drink it before then to get all the good materials from the juice. So by watching this video, I hope that you have learned about this whole carrot juice, green juice benefits. And I know that for the first time, if this is like your first time trying to drink the carrot or the green juice, especially the green juice, it will taste a little ick at first, so it might cause you to be a little bit nauseous, the patient to be a little nauseous, but I'm just trying to say that the health benefits that these two provide will be greater than the little nauseousness that you feel in the beginning for like a couple of minutes, or not even a minute, like a couple of seconds. And I just really hope that you will be able to help the patient make all this so that they will be able to save time. And I know that, again, that this is a tough journey for the both of you guys and for all of you guys within the family. So I hope that by watching my video, you would have learned and feel more at ease, and that you'll be able to feel more confident, especially with the green juice and the carrot juice. Thank you guys, and see you again.